Thanks for taking a few minutes to explore SimpleHealth. This is John Cini in the Washington, D.C. area. This is probably the most amazing presentation I've ever done because I really don't have to say anything. The slides say everything necessary to understand what's going on. It's that simple. I'll fly through the info, and I'm sure you'll agree that we're in the right place at the right time with something so simple and extraordinary. I'm stunned at what's happening in the healthcare world, especially because most people aren't aware of the looming overhaul. I'm going to tell you about a life-changing, society-uplifting, long-term trend that is right at the beginning and how you and everyone you know can benefit from it. I'm going to fly through this info like a doctor racing through a long line of patients. So let's dive in. By the way, all the links referenced in this presentation are posted on a site that you'll see at the end of this video. So you don't have to write them down or hunt for them online or take screenshots. Thank goodness. Okay, let's go. Largest market ever entered by a direct sales company, even bigger than energy. And you can see this Forbes headline from November of 2014. U.S. annual healthcare spending is a stunning $3.5 trillion. A lot of great stats from that article. It's also the biggest inflating market. I mean, you can see the huge increase in health insurance costs compared to inflation. It's actually 3 times faster than inflation, the growth of healthcare costs. Family health insurance costs have increased 120%. That's about a double over the last decade. And that previous Forbes article said these increases are expected to continue. So you can see the links right there to those quotes. Here are 3 more scary stats. Number 1, insured citizens now pay nearly $5,000 a year for family coverage. Number 2, many insurance plans include $1,000 per person out-of-pocket deductible before you get reimbursed. And number 3, and really scary, 41 million Americans still have no health insurance. So on top of that, we're all running to the doctor. This CDC announced Americans make nearly 4 medical visits a year on average. 7 in 10 of those medical visits had at least one medication provided, prescribed, or continued, reaching 2.5 billion prescriptions per year. That number just blew me away. I couldn't believe it. And the Census Bureau reported almost identical numbers. They said, quote, adults made an average of 3.9 visits to doctors, nurses, or other medical providers. So that's all on the books. And we all know this, too. 15-minute visits take a toll on the doctor-patient relationship. That's from April of 2014 from Kaiser Permanente Health News. And there's some pretty astounding quotes from that. Doctors rush through appointments as if on roller skates to see more patients and perform more procedures to make up for flat or declining reimbursements. And the problem may worsen as millions of consumers who gained health coverage through the Affordable Care Act begin to seek care. Doctors have one eye on the patient and one eye on the clock. Many doctors may face greater financial pressure as insurers offering new plans through the health laws exchanges pay them even less money. So you can see the challenge. How many patients should your doctor see each day? This was an article out of the Washington Post from May of 2014, and the article said the average primary care physician has 2,300 patients under care. The American Academy of Family Physicians average member has 93 patient encounters each week, about 19 patients per day, and that's what I've experienced with my own doctor and some of my friends who are doctors. They tell me they see 20-something patients every day. And if that current pattern continues, 44,000 full-time equivalent physicians will be lost from the workforce in the next 4 years simply because of the crush of more and more patients and less pay. And with millions of people newly insured under the Affordable Care Act, patients may face even more challenges finding access to doctors. Same thing that the Kaiser article said. So you're hearing it from all different fronts. And you can bring the doctor to you with up to 70% of doctor office visits and 40% of ER visits unnecessary. Money and time are being wasted. The American Academy of Family Physicians predicts the shortage of family doctors will reach 40,000 in the next 10 years. And actually, the Post article just said 4 years. And the Wellness Council of America said 70% of doctor visits can be safely handled over the phone, and the AMA is quoted all over the Internet saying up to 70% of doctor office visits are merely informational and unnecessary and could be avoided with a phone or email call. So it's pretty obvious what's going on here, and this is an article from June 26 on health IT outcomes. Can telemedicine solve physician shortage? And here's another Forbes article from the end of 2013, Obamacare doctor shortage to spur $2 billion telehealth market. And a week later, Forbes said top health trend for 2014, telehealth to grow over 50%. If you're not familiar with the term telehealth, telemedicine, they're basically interchangeable. It's the same thing, and that is using the internet or using the phone to have a doctor consultation to, resolve an ailment. This is mHealth Watch the pulse of the mobile health community, and on December 19th, they said the future of healthcare points to telemedicine. That was December 19, 2014. 2 days later, on December 21st, look at this Time Magazine article. Should you video chat with your doctor? When to embrace the digital doc. And then the next day, December 22nd, telemedicine market to nearly double over the next 5 years globally, growing at about 20% annually every year for 5 years. And we're well underway with that. Here's an IHS World Market Telehealth Study for 2014, and you can see the number of patients right there in 2014. And then look at the stratospheric growth right there. Here's where we are. And here's where we're going. You can see the trend. And they say in that report that healthcare sectors around the world are looking to decrease overall healthcare expenditure while increasing quality of healthcare. As a result, telehealth is becoming an integral part of healthcare. Telehealth is becoming an integral part of healthcare. Pretty amazing right there. And, in fact, it's going to double in the next 2 years here in the USA. Telemedicine, the future of healthcare is now. And this is from consumereagle.com. Which is like a Consumer Reports website. More than 10 million U.S. consumers used telemedicine last year, and that number is expected to double within the next 2 years. All right, 10 million. Well, let's say it's 30 million. 330 million people are in the U.S., and if we have 30 million of them on using telemedicine already, that would still leave 300 million people that are not on it. To me, that is a flashing neon sign of a wide open market. So we're in the right place at the right time. And what's really amazing is I don't know anyone who has this service. Now, maybe there's some people that have it and they don't even know they have it, or they have it but they don't really, see what it's like revolutionizing healthcare, but it is. So in that Consumer Eagle article, it said consumers are only just beginning to be aware of telemedicine, but much like the ATM card changed the banking world for Americans, so will telemedicine transform the way people receive health care in the coming years. And that's from the CEO of the American Telemedicine Association. And all of that is fresh info. And here's something that's really shocking that just happened in January 2015, January 5th. Investment in digital health surges. And you can see here the burgeoning digital health industry welcomed more than $4 billion in venture funding in 2014, a sum nearly equal to the prior 3 years combined, according to a study by Rock Health. I should have blown that quote up right there. The sector that saw the most growth was telemedicine startups, which raised $285 million to provide healthcare diagnoses through phones, videos, text messaging, and other online tools. Such companies included Teladoc and Doctor on Demand. Telemedicine companies will be a mainstay, Rock Health predicted, as insurers work out ways to reimburse doctors for delivering care remotely. And there are already many organizations, including Medicare and Medicaid, that reimburse in just about all the states for telemedicine visits. So everything's in place. Investors, a.k.a. rich people, know all about this. If you haven't seen this ABC News clip with Diane Sawyer, make sure you check it out on napnetwork.com. And the title of the story, the report on ABC, you can actually see it on the ABC News website, which is also listed on that napnetwork.com along with the video. Cutting your doctor bills in half without going to the doctor's office. That's a pretty amazing statement, cutting your bills in half. And this Harvard Business Review article says telemedicine can cut healthcare costs by 90%. That's a little bit more than half. They're eliminating all of the bureaucracy and the middlemen and taking it right between the patient and the doctor. That's what telemedicine is doing. Technology is reducing costs. If you've not, here's the article. If you've not yet heard of telemedicine or think it's not a great way to deliver quality health care, you may want to read this. Telemedicine, made possible by the availability of mobile networks, is revolutionizing health care. So here we are right smack in front of that amazing trend. And so introducing SimpleHealth. Welcome to our new service that actually launches in March of 2015. And it comes from a company called Thrive, which is a division of North American Power, a 5-year-old energy company headquartered in Norwalk, Connecticut. North American Power is founded by some people who identify trends and get in front of them. They've made a fortune in the energy sector, and now they're doing it in healthcare too. And you can see North American Power was listed on Forbes Magazine's 100 Most Promising Companies list in 2011. In the next couple of years, they won several Stevie Awards, which is a nickname for the American Business Awards. They just became a member of the Direct Selling Association in 2014 after a year-long application process that's required. And then Chief Executive Magazine listed North American Power as one of their 100 elite mid-market companies in 2014. And the Direct Selling News has NAP listed as one of their 100 global top direct selling companies in the world, that would be global, in 2013 and 2014. So they're on that list, and they'll probably be in the top 30 or 40 for 2000. In the new list that comes out in 2015. And they were, for 2014, number 476 on the Inc. 500 list, which is actually now the Inc. 5000 list. So they've had tremendous growth. In fact, they will be, after 2014 revenue is officially announced, somewhere around $400 million, one of the fastest companies in history to go from startup to $1 billion in revenue in their first 5 years. NAP enrolls tens of thousands of customers monthly for their energy business, and they're ready for millions of SimpleHealth enrollment. So they've got the infrastructure in place, and the corporate officials running this company have taken other companies to billions of dollars in revenue. So it's not like they're going to get surprised by all the growth here. They're expecting it, and they're ready for it. And you can check to see if you could save money by switching your electricity or your natural gas bill to North American Power, and you may even be able to earn free energy by referring others to it also. So they got a great setup there. Make sure you check that out and know about that also. But let's focus on SimpleHealth and their telemedicine partner, a company called Teladoc, which I mentioned earlier. Teladoc is the first and largest telehealth network in the USA, over 10 years old, with unlimited 24/7 access to state-licensed, board-certified physicians with an average of 15 years experience practicing medicine and a 95% patient satisfaction rate, and they've never had a malpractice claim. That is fantastic. They were one of Fast Company Magazine's 2013 top 10 most innovative companies in healthcare, and they were on Red Herring Magazine's list of top 100 most promising private ventures in North America. So you can see they are growing like crazy, and everybody's taken note. They've been featured everywhere in all these different news organizations and articles there. They are the #1 network in telehealth by far, the first and only telehealth provider to receive certification from the National Committee for Quality Assurance, which I'm sure you're familiar with them, right, for doctor credentialing. Just kidding. But there they are, and they're, like I said, the first and only telehealth provider to receive that certification. So that's another way that you can feel confident about the quality of care you're getting from them. And here are the benefits of SimpleHealth telemedicine. First and foremost is you can avoid this scenario of sitting in a waiting room somewhere. Immediate access to real doctors, no cost per consultation, no insurance needed. Entire family is included, no appointments or waiting room, convenient, urgent care, peace of mind, less wasted time, hassle-free second opinions if you need them, coast-to-coast availability in 46 states of the 50. And pretty soon it'll be all 50 states, and the potential to save hundreds of dollars per year or more, as the ABC News story said, cutting your costs in half. And here's how it works. It's very simple. This is a simulated video consultation. Here's a doctor talking to the patient on a web chat. You can also, again, do it over the phone, but if you want the doctor to see, a rash or something that is hurting you, then you probably want to be able to do that. You can actually do the video consults from a desktop, laptop, iPhone, iPad, Android phone. Any smartphone will do. You can do it anytime, anywhere, from your home, a friend's house, on the top of a mountain. It's just simple. Here's the Teladoc app. It takes just a minute to install it on your computer or your phone, and you just click on that Request a Consult button, and then you can choose what time you want to have a consultation with the doctor. And you can add your family members. Here's a daughter listed and a husband under My Family, and you can list your health problems. These are all securely stored, so you don't have to worry about anybody seeing your data. Frequent colds, yes. Current, yes. Seasonal allergies, yes. Current, no. So you fill all that out. The doctors can check it out. The doctor's the only one that would see it. And here's some stats off of the teledoc.com website. 95% member satisfaction, zero malpractice, as we talked about before. Average callback time is only 16 minutes to get that appointment if you need it right away. And then 17-minute average consultation duration. And they just surpassed 8 million members in 2014, and 9 out of 10 patient issues are resolved. That's a fantastic track record. I think it's the best in the industry. But it's just so much more than telemedicine. It's all kinds of ways to get healthy, eat healthy, live healthy, stay healthy. You can get a prescription discount card for up to 75% off of retail prices at over 61,000 pharmacies nationwide, with online consultations with licensed health specialists, including psychologists, pharmacists, pediatricians, dietitians, on and on. We have a body transformation program, coaching from licensed fitness and nutrition experts. We have an online organic shopping area with free nationwide shipping. We can't wait till that comes out. And then discounts at thousands of gyms, spas, fitness, and wellness centers all over the country. I mean, you just imagine what you can do here. You think about that. What would you pay for all of that service right there with SimpleHealth? Well, you can proactively improve your health and quality of life year-round for $50 a month with no other costs or surprise fees, no gotcha, no hidden admin stuff or renewal costs. It's all right there for $49.99 a month. Now, here's healthitconsultant.net, hitconsultant.net. Walgreens to offer telehealth visits through MD Live. This is fresh. That's December 9th of 2014. Walgreens is the largest drugstore in America, and they are diving in right here at the end of 2014. You can see the Chicago Trib ran the same headline on December 8th, the day before. Walgreens app makes virtual doctor visits a reality. And they start off the article saying you might not have to leave your cubicle at work or your couch at home to get that sore throat or nasty cough checked out. Walgreens is launching a virtual doctor visit feature on its mobile app, the company announced Monday. The nation's largest drugstore chain is teaming up with MD Live, a provider of virtual health services, to connect Walgreens customers with certified doctors via video chat on a smartphone, tablet, or computer. Now, here is the Google Play Store where you go to download Android apps. And in their medical category, you can see the top 3 apps in their medical section. The first 5 are not telemedicine, and these change every week, but that week, number 6 was Amwell, which is another telemedicine provider, and you can click on that, and you'll see they've had 500,000 to 1 million installs. Now, we all know that just because you download an app doesn't mean you use it, so we don't know how many people are actually using that app, but they've got several million people that have installed it between Android and the iPhone store, iTunes store, and they're not the only ones. You can see Doctor on Demand is another one in the top 20 of the downloads, and you can see they've had 100,000 to 500,000 downloads of their app. And it's interesting to note on their site, you'll see they say doctor visits are only $40 each, same as a copay, much less than urgent care or the ER. So we can, do a little comparison shopping here. At Amwell, they tell you that each visit is just $49, and then you can go to the MD Live site, the ones that just teamed up with Walgreens, and they're only $49 a visit also. So, and then there's HealthTap, which they claim they saved 17,800 lives and answered 2.5 billion questions, and they only charge $99 a month for doctor visits. So you can see the trend and the competition that's out there. This is Mobile Health Marketplace, and they talked about Teladoc, how they've been offering telemedicine services since 2002, so 12 years old. Since September of 2013, Teladoc has moved up consistently to rank in the top 250 downloaded medical apps at the iTunes store. Since launching their app in September 2013, Amwell has moved up to rank consistently in the top 50 medical apps at the iTunes store. So you can see there Amwell is actually spanking Teladoc in terms of the number of downloads of their app. And they rolled out the Amwell service to almost 4 million subscribers in 2013 and expect to add another 32 million in the next 18 months. That's a pretty amazing statement right there. But, Teladoc is still number one. And even though they haven't attacked the app download, the individual market aggressively, they're starting to. That's where we come in. And you can see here they've grown from 4 million members to 8 million members in the last couple of years. But most of that growth has come from large company enrollments. But now they're expanding by reaching individual consumers. Now, how is the best way to do that? Well, there's no question about it. It's all word of mouth. That's what direct sales is, and that's where we come in. Timing is everything. We got an amazing service, an even more amazing opportunity here. We're available in 46 of the 50 states. You can see we're not yet in Washington, Idaho, Arkansas, or Vermont, but we will be soon. We reach everybody else. Singles and families, even people in those states can plug in with us and share the information, English and Spanish, and get incredible income for referring other people. So it's a real simple process. All you have to do to plug in with us is go to the website of the person that invited you. It's www.thrivehome.com/their rep ID number, and then you enroll right there through our North American Power sign-up. That's how you do it. But do more research. Get back to the person that invited you. Watch our compensation video, and that explains not only how you get paid, but how you can get free SimpleHealth service and start making money today. You don't have to wait for all of this. You can check out all the details at napnetwork.com, and that's where you get all the links to everything that was referenced in this presentation. You can also download an official 2-page corporate summary of our SimpleHealth business right there at that site. So thanks for your time, and look forward to seeing a lot more on SimpleHealth coming in the very near future. Have a great day.